Okay, now let's move on to your project, which is the main focus of this interview. And can you tell us what is actually MIND about?
Yeah, so MIND stands for Medical Intelligence for Next Generation Diagnostics. It's Austrian developed AI tool which will be used for medical diagnostics of infectious diseases in Austria. So it's purely Austrian developed AI tool developed for Austrian people in Austria with the system and not against the system. And I think our vision is to make healthcare in Austria more accessible to people in Austria, more easier to use, and consequently increase quality of healthcare as well. That's our mission and that's our goal.
And how does MIND actually work?
So think about scenario which unfortunately we have very often in Austria. We have perfect climate for viruses to thrive. So we have season of infectious diseases in Austria between September and May, even June can go into this account. So very long season where viruses are thriving, so to say. What consequently is caused is that people are ill with mild conditions, so not serious illnesses, very often. So you can be in Austria ill every 2-3 weeks with 2-3 days, right? So I think this is something everyone experiences. What you actually do then is you are not feeling well, you go to your doctor, people have to travel there, go with public transport with their cars. You go and wait there for hours only to be taken into doctor's office for 3 to 5 minutes because he cannot or she cannot possibly give you more time. To be diagnosed with something such as rest at home. Well, I should have rested at home, right? Why did I even come here? That's sort of inefficient, it doesn't make sense. And with demographic changes in Austria, where we have overgrowing population and aging population, this problem is becoming even more present. So MIND is aiming to solve this. So imagine a different scenario where you feel sick and instead of wasting hours and efforts to go to doctor, you just need to take your phone, put in your parameters. MIND is such an intelligent platform. It knows your profile. It knows your medical history from the moment you were born, from your Mutter-Kind-Pass in Austria, until now, everything about you. The moment you start diagnosis with current systems, intelligent system behind runs millions of medical rules in seconds and gives you best diagnosis that you could possibly have, what is happening to your body. And based on that, you can make decision to rest at home, to go to doctor if needed, if you have infection, for example, but you do not lose the time and effort going to a doctor only to be diagnosed with something as rest at home. So I think there we are trying to eliminate a number of patients who are overstressing these general practitioners or Hausärzte, that they don't have to commute and go there. This will consequently make illnesses more controllable. Infection diseases should not be spread further, right? And also people will get back control of their life and have quality time for resting, right? What you should do is stay at home and rest. Ultimately, we also envision that you could send the report from MIND to your employer for children in school as well. So it's a long process which we will engage into. But what our ultimate vision here is that you have accessible healthcare with gaining control over time and quality of your life.
I know about the range of the people in your MIND team, but tell us, who is exactly sitting around the table when you have a MIND meeting?
When we have a MIND meeting and you come in, you would really see diverse group. So there are really amazing people sitting around the table, starting with our tech team, where you, Roya, would be sitting as well. So we have AI experts, different kinds of AI experts. We have software developers, we have general electrical engineers. Then we have our medical team. There we have professors of general medicine. We have infectious disease experts from Kepler University Hospital. Then we have social partners, policymakers as well, who need to tell us how to bring this to people, right? So we have very diverse team. And what I'm particularly proud of is that if you would walk in, you would see a lot of women in this group. A lot of women sitting on this table as well. I'm really proud of this.
Very great, very unique.
Very unique.
Yeah. And yeah, you're planning to turn MIND into a spin-off. What actually drives you to take this decision?
Yeah, I am in general very pragmatic and I'm always thinking about the impact. How can I make something impactful? And impact increases when you turn research innovation or research idea into something that people can actually use in their everyday life. And this is exactly what spin-offs and startups are trying to do. So you transform your idea, innovation, which you do at university level or in research, and you make it into product. And this makes further impact in everyday life of people. And I think it's also a great way for universities to transform innovation into progress. So I think it's in general very nice direction, and for Mind, definitely we want this.
And at the end, if people just remember one thing about you and your project actually, what should you prefer to remember?
As I said in one of these things we have discussed throughout the day, I think I want people to remember what is our motivation here, why are we doing what we are doing. Today it is this technology, it could evolve into something else tomorrow, but it's not important. What is important is why are we doing things? We are doing them to make people's lives easier and better, and to give people back control of two things which we cannot compromise: time and health. Those are two things, when we compromise them, we can never get them back. And I think in today's society, we have reached a point where time and health are not prioritized anymore. We are lost in so many things in our everyday life. Our health is suffering consequently. So I think technology can help gain control over these things. And what we are trying to do in our team is exactly this: help people in Austria get control over their time and health and work with the system and not against the system.
Definitely.
Thank you, Roya, for all these wonderful questions.
Thank you for having me.
Yeah.